Have you ever wondered, could the pills you're taking every single day be silently affecting your brain? What if the medication you thought was protecting your health is actually putting you at risk of something far more devastating? Dementia. Seniors around the world take multiple prescriptions for blood pressure, cholesterol, sleep, or allergies without ever being told that some of these drugs can slowly chip away at memory, focus, and even independence. Today, we uncover the shocking truth about 9 common medications that science shows may increase the risk of dementia. If you or someone you love is over 60, this information could be life-changing. Stay with us until the very end, because knowing which pills to avoid and what safer alternatives exist could protect your brain for years to come. Let's begin with the first medication group: anticholinergic drugs. These are too commonly prescribed for allergies, insomnia, depression, or even bladder problems. Drugs like diphenhydramine, Benadryl, oxybutynin for overactive bladder, or certain antidepressants fall into this category. They work by blocking acetylcholine, a neurotransmitter vital for learning and memory. The problem? Research shows that long-term use, especially in older adults, is directly linked to cognitive decline and even dementia. One large study from JAMA Internal Medicine found that seniors with heavy anticholinergic exposure had a 54% higher risk of developing dementia. Imagine, a pill you take for sleep or runny nose could actually be making your brain weaker. Doctors often don't highlight this risk, but alternatives exist. For example, instead of diphenhydramine for sleep, cognitive behavioral therapy or melatonin can be safer. For allergies, non-sedating antihistamines like loratadine may be better. Benzodiazepines, drugs like diazepam, Valium, lorazepam, Ativan, alprazolam, Xanax, are commonly given for anxiety, sleep, or panic attacks. They calm the brain by enhancing GABA, a neurotransmitter that slows activity. But for seniors, the cost can be devastating. Multiple studies, including one published in the British Medical Journal, link benzodiazepine use with increased dementia risk, falls, and even premature mortality. Why? Because while these medications may help with short-term anxiety, they sedate the brain, impair memory formation, and reduce the brain's ability to build new connections. Seniors often notice fogginess, confusion, or difficulty remembering recent events. Safer strategies include cognitive therapy, mindfulness, or in some cases, SSRIs, under doctor guidance, which don't carry the same dementia risk. Antipsychotic medications. Many seniors are prescribed antipsychotics such as haloperidol, Haldol, risperidone, Risperdal, or quetiapine, Seroquel, often not for psychotic illness, but for sleep, agitation, or behavioral issues in dementia itself. But here's the shocking truth. While they may calm agitation, these drugs can actually accelerate cognitive decline. Research published in the New England Journal of Medicine found that seniors with dementia who were prescribed antipsychotics had a 60–70% higher risk of worsening brain function and even premature death. These medications interfere with dopamine pathways, which are critical for cognition and motivation. Seniors often experience side effects like stiffness, drowsiness, or even hallucinations. Doctors are becoming more cautious, but many still prescribe these drugs as quick fixes. Safer alternatives include behavioral therapies, structured daily routines, and in some cases, antidepressants under careful supervision. Proton pump inhibitors, PPIs. You've probably heard of drugs like omeprazole, Prilosec, pantoprazole, Protonix, or esomeprazole, Nexium. They're given for acid reflux, heartburn, or GERD, conditions very common in older adults. But long-term use has been linked to higher dementia risk. Why? PPIs reduce stomach acid, which is essential for absorbing vital nutrients like vitamin B12 and magnesium. Deficiency in these nutrients is strongly tied to memory loss, confusion, and neurological decline. A major German study in JAMA Neurology reported that seniors taking PPIs long-term were 44% more likely to develop dementia compared to those who didn't. The danger is not in short-term, occasional use, but in daily, long-term reliance. Safer strategies include lifestyle changes like smaller meals, avoiding late-night eating, and elevating the head while sleeping. In some cases, switching to H2 blockers like famotidine, Pepcid, may be less risky. Statins, cholesterol-lowering drugs. This one is controversial. Statins such as atorvastatin, Lipitor, Simvastatin, Zocor, or rosuvastatin, Crestor, are some of the most prescribed medications in the world. They reduce cholesterol and protect against heart disease, but evidence shows a possible downside for the brain. Cholesterol is not the enemy of the brain. In fact, it's vital for forming synapses and protecting neurons. Some studies have linked long-term statin use to memory problems, confusion, and even increased dementia risk, especially in seniors who are sensitive. The FDA has even issued warnings about statin-related cognitive side effects. That said, statins also have benefits, especially for preventing stroke, which itself can lead to vascular dementia. The key is not to stop statins suddenly, but to carefully evaluate whether you truly need them, or if lifestyle changes, diet, and exercise could be enough. Seniors should always review statin use with their doctor, balancing heart protection against brain health. Anticholinergic medications. Perhaps the most dangerous group for seniors' memory is anticholinergic drugs. These include a wide range of medications like diphenhydramine, Benadryl, oxybutynin, ditropan, tolterodine, Ditrol, amitriptyline, and even some muscle relaxants. They all work by blocking the chemical messenger acetylcholine, which is essential for learning, attention, and memory. Unfortunately, in seniors, blocking acetylcholine can have devastating effects: confusion, delirium, and rapid cognitive decline. A long-term study in JAMA Internal Medicine showed that older adults who took strong anticholinergics daily for just 3 years had a 54% higher risk of dementia. What's worse, many of these are available over the counter, meaning seniors may be harming their brain health without even knowing. Safer options include non-drug therapies for allergies, bladder training for incontinence, or switching to medications with lower anticholinergic load. Benzodiazepines. These are sedatives used for anxiety, insomnia, or panic attacks. Common names include diazepam, Valium, lorazepam, Ativan, alprazolam, Xanax, and temazepam, Restoril. They may provide short-term relief, but long-term use is extremely risky for seniors. Benzodiazepines slow down brain activity, impair short-term memory, and increase the risk of falls. A Harvard study found that seniors who used benzodiazepines long-term had a 50 higher chance of developing Alzheimer's disease. The danger lies in the fact that these drugs are habit-forming, and stopping them suddenly can cause withdrawal symptoms. Safer alternatives may include cognitive behavioral therapy for insomnia, meditation, relaxation exercises, and melatonin supplements under medical guidance. Sleep aids, non-benzodiazepine hypnotics, drugs like zolpidem, Ambien, Zaloplon, Sonata, and Ezopiclone, Lunesta, are marketed as safer alternatives to benzodiazepines. But the truth is, they're not much safer. These so-called Z drugs can still impair memory, cause daytime drowsiness, and are linked to dementia when used chronically. Seniors are particularly vulnerable because their bodies metabolize these drugs more slowly, leading to stronger effects. In addition, sleep aids often increase the risk of sleepwalking, confusion at night, and dangerous falls. Natural strategies like improving sleep hygiene, practicing relaxation techniques, and maintaining a consistent bedtime routine are far safer. Pain medications, opioids, and some prescription analgesics. Chronic pain is very common in seniors, and many are prescribed opioid painkillers like oxycodone, OxyContin, hydrocodone, Vicodin, or morphine. While these can help manage severe pain, they also depress brain activity, leading to confusion, memory problems, and long-term brain fog. Some studies suggest that prolonged opioid use is linked with structural changes in the brain's white matter, which plays a critical role in communication between brain regions. Beyond the dementia risk, opioids also increase the chance of falls, constipation, and dangerous drug interactions. Non-opioid approaches like physical therapy, acupuncture, mindfulness, and safer medications like acetaminophen, Tylenol, may be better long-term strategies for pain management. So, seniors, here's the bottom line. The medications we've discussed, antidepressants, anti-anxiety drugs, antipsychotics, PPIs, statins, anticholinergics, benzodiazepines, sleep aids, and opioids, are all widely prescribed, but they may silently increase your risk of dementia. This does not mean you should stop any medication on your own. That can be very dangerous. Instead, use this knowledge as power. Talk openly with your doctor, ask about safer alternatives, and remember that lifestyle changes often work better than pills. Staying active, eating well, getting enough sleep, and keeping your brain engaged are some of the most powerful medications you can give yourself. And before we close, if you found this video valuable, don't forget to hit that subscribe button to Senior Secrets TV, where every week we share science-backed tips, hidden health truths, and longevity secrets that can help you live your strongest years with clarity and confidence. Because age is not the end. It's the beginning of wisdom, strength, and vitality.